The onset of labor. The clinical signs of the onset of the labor are regular and painful contractions. So beginning of the regular contractions of the uterus, regular and painful, is the beginning first sign of the onset of the labor. Passage of blood stained with mucus from cervix, this is called the Shaw. Shaw is the mucus mixed with blood. This is the indication that the uterus is contracting, and painful regular contraction cause the bleeding, and this blood which is mixed with the mucus is known as the bloody Shaw or the Shaw. Rupture of fetal membrane or without uterine contraction. So can be without the rupture of the membrane or without regular contractions. PROM is the term used for pre-labor rupture of membrane, and PRROM is the preterm pre-labor rupture of membranes. So these are two terms used. PROM is pre-labor rupture of membrane, and PRROM is preterm pre-labor rupture of membranes.